Good morning, my name is Robert Vera. I am going to tell about therapeutic hypothermia after hospital cardiac arrest in children. Definition: therapeutic hypothermia is a procedure used to cool the person's body to the temperature that is lower than normal. The procedure is done after cardiac arrest when it occurs in an environment away from medical care.
What is therapeutic hypothermia? You're watching this video because your baby needs therapeutic hypothermia, which is also commonly called cooling. Thanks to medical research, we know that cooling your baby by 3 degrees for 3 days can improve your baby's outcomes and protect your baby's developing brain. There are lots of reasons why babies need to receive therapeutic cooling. Your baby will be cooled using a cooling blanket and will be asleep throughout the entire process. The technology and the equipment in the neonatal intensive care unit can seem super scary, especially when your baby is so small. So it's really important to remember that your precious baby will receive expert intensive care and medication. The team will make sure your baby remains comfortable while receiving the cooling therapy, which offers neuroprotection, leading to less neurodisability and better long-term neurodevelopmental outcomes for your baby.
Pros and cons. The main beneficial and protective effects of therapeutic hypothermia consist in reducing general brain injury through multifactorial effects such as reducing the metabolic output of cells as well as they reduce oxygen consumption. The negative points are the different phase, the induction phase that has to be carried out quickly, the maintenance phase that has to be constant and controlled, and the rewarming phase that must be monitored for side effects.
Cardiac arrest has a very high mortality rate, and it's due to a variety of reasons. The brain starts to undergo a degeneration, basically a self-destruction, where certain chemical processes start to take place, which accelerates cell death. From the time of arrest to the time you reestablish that circulation is what determines your survivability. By starting hypothermia, by reducing the body's core temperature, you actually stop the internal injury process that takes place on a chemical basis. How you institute hypothermia can vary. The main goal is to try to drop that temperature down to about 32 degrees Celsius within about 3 to 6 hours of the time of the arrest. That's your magic window of achieving that hypothermia. You happen to be picked up by an ambulance who is equipped and educated. A hypothermic cooling blanket could be applied. Ice packs placed into the high circulation areas, the axilla, the underarms, the groins, even around the head. Once you're in the hospital, we have some devices that are more formal or sophisticated in cooling blankets, and then another device that's actually inserted into the main vein of the abdomen that exchanges heat internally very aggressively. So we will also institute other sedative drugs to kind of calm the brain's actions, and also muscle paralytics, paralyzing drugs to prevent shivering, which is a natural response, but that consumes oxygen, so you don't want that taking place. So in addition to the natural coma that the patient's in, the drugs will help, blunt any feeling of discomfort or, that you're actually cold. Therapeutic hypothermia has not been widely adopted. It's one of these unusual therapies in our world, which we see often with a lot of novel therapies. That's been around and accepted for almost a decade, but has been slow to evolve into common practice. And it's one of the things that we're dealing with from a medical education standpoint, is to get this therapy out to the public and get it instituted in a timely manner.
We should uplift in Ecuador. Although there are a lack of therapeutic alternatives in Ecuador, therapeutic hypothermia is used from 10% to 20% due to the lack of convincing scientific evidence, but mainly because the whole process and maintenance is too technically difficult. Another important factor is that there are enough doctors who feel prepared to perform this technique safely, and is used in critical moments when there is no option and it is required to avoid further harm in the pediatric patients. Applications in medicine. Therapeutic hypothermia has three treatment phases. First, the induction phase, where the objective is to get the temperature below 34 degrees Celsius as soon as possible. Second, the maintenance phase, the objective is to rigorously control the core temperature with little or no fluctuations. Third, the reheat phase, which should be slow with temperature increase from 0.1 to 0.2 per hour. Fourth, controlled normothermic phase, the objective is to maintain a temperature of 36 to 37.5 degrees Celsius to avoid deleterious effects.
21-year-old Jay Eam is recovering at Ronald Reagan UCLA Medical Center after collapsing in full cardiac arrest while running the recent LA Marathon.
I went from running for the LA Marathon and then suddenly, just kind of fighting to live.
Good for you. Finally out of that bed.
Jay's life was saved by an uncommon twist of fate. 15-year veteran LAPD officer Joshua Sewell was at milepost 18 when Jay went down.
That's usually about the point, people start to get dehydrated and their legs lock up and so forth. So we figured it was just another case of, dehydration or muscle fatigue or something like that. I took a pulse at that point. There was no pulse, no breathing. Rolled his eyelids back. His eyes were rolled back into his head. So he was in full cardiac arrest at that point.
Officer Sewell immediately began CPR.
How are you, sir?
Much better.
And UCLA physician and professor of surgery, Dr. Charles Chandler, just happened to be 50 yards from the scene.
I was on my way to work, but decided to stop by as a spectator. I just made a quick assessment of how he was, what the likely problem was, and who was doing what, and how well they were doing it, and what he needed, and how to get him out of there.
Jay was rushed to Ronald Reagan UCLA Medical Center, where Faith again intervened. UCLA is one of only a handful of hospitals equipped with a sophisticated thermo-cooling device that doctors could employ to again save Jay's life.
Most people who have cardiac arrest out in the field, as we say, on the street, don't survive. Most. The catheter comes in here. So this is a machine. It's a cooling instrument, which consists of a catheter that goes into the blood vessel, and it's a catheter that basically circulates cold fluid inside of this blood vein, and that allows you to cool the blood like a radiator cools a car.
UCLA helped to develop this technology that puts the body into a state similar to hibernation, protecting it from damage. Jay was placed in a coma-like state and cooled to 89 degrees Fahrenheit for 3 days, then slowly brought back to a normal temperature.
He's not had any real sign of permanent brain damage, so this therapy really saved him, and he's doing excellent. Put your hands up like this.
I haven't heard of them using it before, so I'm actually surprised that it works so well. So I'm completely grateful for that.
It's amazing. It's amazing. Every night I always called to check up on him because he was just like, we were rooting for him, and so it was such a beautiful recovery for him.
Jay is expected to make a full recovery. He's a pre-med student who plans to become an ER doctor. And Officer Sewell, who is also a runner, says whenever Jay's ready, he will strap on his running shoes and they will finish the last few miles of the marathon together.
Absolute miracle. It was, the marathon itself is near and dear to my heart. I ran it in 2006, and being able to assist another runner like this is just beyond words.
Conclusion. Although therapeutic hypothermia is beneficial and few studies support its efficacy and vary enormously depending on the doctor who practices it and the patient. Therapeutic hypothermia in post-cardiac arrest syndrome is currently considered standard care and is recommended by different international organizations about resuscitation.